I don't want AI in my care. You better not be using AI. I could unfortunately see that happening.
I thought of a different angle because we brought it all the way down to the end user. And then we have the patient. So a lot of people ask, and I'd love to know your thoughts on informed consent. Like, where is the line? Should there be a line? Or, where a patient either is informed and says yes, or these are the tools that are necessary. They're not necessarily doing informed consent for some perhaps other pieces of technology that are in healthcare. But I'm going to take it a step further and ask you, do they even bear a little bit of responsibility, shared responsibility as these things come in? Are they kind of like, in a sanctuary from that? And I assume if so, then should they be able to opt out if they're going to be sharing the responsibility, et cetera? Tell me your thoughts, because I know this is an area of interest.
Yeah, I mean, it's so tricky because on the one hand, I mean, healthcare has changed so much, and the patient's perspective and a patient being centered in healthcare has changed so dramatically, right? Like I think about even in the time that I've been practicing, access to technology, access to information has really changed the way that patients engage with the healthcare system overall, right? I think we're in a new world, whether we like it or not, as doctors, where we are going to be questioned by our patients about every little thing, and they are going to Google and probably now to ChatGPT, and they are asking a whole host of questions, and they are an active participant in their healthcare, which I think, I think is great to a certain extent. I think it can definitely go overboard, and we have to manage that, right? So on the one hand, when I think about what the patient's responsibility in doing all of this is, do I think it's a responsibility to ask their doctor questions about if they're using AI? I don't know. I really haven't thought about that specific question of whether or not it's their responsibility to ask. I think we're moving towards the direction of, from a regulatory perspective and in general best practice, I think a lot of people would say that you should obtain some form of consent in the use of AI for your patients right now. I think that's probably the right call. I think like that makes sense, again, because I think of it as a new and emerging technology. And I think as you start to use something new, you should at least be providing your patient with information around what it is, what kind of tools you are using, whether it's like full informed consent and you're asking for for consent in those situations. I don't know if we're necessarily there. This question of like whether or not patients can or should be able to opt out of AI being used in their healthcare is really interesting, right? Like I think right now in the current state, in whatever September 10th, 2025, right?
I believe that's right.
Yeah, I think that's the right year. I don't think that it is AI right now is not the standard of care, right? Like we sit here and I don't think that anybody would say it is the current standard of care to use AI for any particular thing. Will that change over time? I think probably, right? Like I definitely think there is a future state, whether that's in 1 year, 5 years, 10 years, where artificial intelligence, whether through, basic workflows or for clinical decision support, is a part of standard practice and considered standard of care. Yeah, I think we're going to get there. At that time, are you ultimately able to opt out of that? I think that's where it's going to be really fascinating to know, are we able to even do that, right? I think about one of the things I'm most fascinated about is right now we can pretty easily carve out what is AI and what is not in your kind of digital workflow as you're taking care of a patient. So as you're taking care of a patient, you have a pretty good idea. And as an EHR vendor, we have to make it readily known to you if and when you are using AI in your day-to-day care, so you know what those pieces are. I do think that we're going to get to a point where AI is so embedded in the EHR and so embedded in the workflow, it's really going to be impossible from a digital perspective to carve it out, right? Like I can't just turn off AI for this feature and go back to the old school one and turn it on for this and turn it off for this. And are we going to have two different versions of an EMR, one that has AI and one that doesn't? And I have to work through that. That doesn't feel like it's going to happen. So I don't know. I'm going to be very curious to see the patient's perspective on artificial intelligence. My current hypothesis is that patients are going to be pretty ready to have this used in their routine care. But I'd be fascinated to know like what other doctors are seeing or experiencing as they talk to patients about that. Like, I know as we kind of roll out these ambient tools, a lot of our practices are doing doing consent. I'd be very curious how often they're not consenting to those things and what the rationale is for that. I think that people can, especially, this day and age, are very skeptical of all things healthcare delivery. So I wouldn't be surprised if you have a subset of people that are skeptical about AI and don't want that used. But is it this, is it exponentially going to grow or is it going to shrink? I think that's what's going to be really interesting. But I do think there will be a pit, like if and when we have a harm event that occurs because of an AI tool, and that news story that breaks of this patient was harmed because of this specific AI tool, I think like that is where I'm going to be really fascinated to see where the perception goes. And do we totally migrate away from, I don't want AI in my care, you better not be using AI? I could unfortunately see that happening. And so it's like, how do we avoid that? Because I think that would be a tremendous detriment to the, to the broader healthcare community. So it would be like, oh, we have this great technology, now we can't use it because small things.